One night a few years ago, I was sitting at home with my husband and my grandson, and without any warning or without any pain, I stopped. I lied down on the couch and my heart stopped. My husband noticed right away that something was wrong, and he got up, he called 911, and he immediately started CPR until the rescue arrived. They delivered shocks with a defibrillator 6 times to try to get my heart started again. And right before I arrived at Rhode Island Hospital, my heart started to beat again. That amount of time that it was not beating was approximately 30 minutes. I'm told that there was a team of people waiting outside of the emergency room of about a dozen people. And they took me very quickly into the emergency room to try to get me stabilized. They rushed me up into the cardiac cath department to, I believe, put a balloon pump in, just to try to get me to a safer point. Then they put me into a medically induced coma to try to get my body to start to heal a little bit. Dr. Singh performed open heart surgery to repair a leaking mitral valve. I had a long recovery after that. It was still a couple of weeks even after the surgery that my body was still trying to recover from the initial trauma. I was the patient, but my story is everything that I've heard from my family. And when my family tells me about stories about what happened to me, it always involves the nursing staff, the physicians, my housekeeping woman who came every morning, everybody who was there helping me but supporting them at the same time. When I started the Center for Cardiac Fitness at the Miriam Hospital, I went in with a very high level of fear because now I needed to mend physically as well as emotionally. And when I realized they were putting me on an exercise program that was going to elevate my heart, I was very fearful to do anything like that. The staff there, they really are an amazing staff. They are so supportive, they are so knowledgeable. They knew how to get me to the goal, to where I needed to get to. I always strongly recommend the Cardiovascular Institute of Rhode Island and Miriam hospitals. As a patient, they not only treated me, but they treated my family. And when you're going through, whether it's a traumatic event or you are just finding out that you have heart disease, you want some place that's close to home. You want some place where you can easily get to your physicians, where your family can get to you if you need their support, whether it be in the hospital or in a cardiac rehab program or just in the doctor's office. There is no better place to be. They have the expertise, they have the technology. They are the place to go.